Take a moment. Run your tongue gently along your teeth, right where they meet the gums. Do you feel a tiny dip? A narrow groove? A little V-shaped nook that wasn't always there? If so, you are not alone. Many people, especially after the age of 50, begin to notice these mysterious notches. They may seem harmless, perhaps just another sign of getting older. Some people blame their toothbrush, others think it's simply the shape of their teeth. But the truth is far more important, because these notches have a name: dental abfraction. And they are not just cosmetic flaws, they are your body's warning signal, a gentle alarm ringing through your smile. Most people ignore them, some shrug them off for years, but the consequences of doing nothing, they can quietly accumulate, until one day they can no longer be ignored. In this video, we will walk through exactly what these notches mean, why they appear, what they do to your teeth, and what can happen if you simply let them grow. And if you stay with me until the end, you will discover what you can do, step by step, calmly and clearly, to protect your teeth, reduce sensitivity, and prevent long-term damage, using solutions tailored specifically for seniors. This isn't a video about fear, it's a video about understanding, about clarity, and about taking gentle control over a part of your health that is easy to overlook. So let's begin. 1. What exactly is a dental abfraction? Let's imagine something simple. Picture a fresh, flexible twig. When you bend it, the middle looks unchanged, but the place where the twig narrows, the weaker, thinner point, the bark begins to flake. It doesn't happen suddenly. There is no dramatic snap. Just tiny, microscopic breaks, layer by layer, until the bark slowly disappears. Your tooth behaves in exactly the same way. A dental abfraction is a loss of tooth structure right at the gum line, most often shaped like a wedge or a V, not round like a cavity.
Not smoothed out like erosion, but angular, sharp, almost carved. Why there? Because that is the weakest point of the tooth, the point that receives the strain when forces are not balanced. And here is the part most people never hear. Most abfractions are not caused by brushing. Yes, aggressive brushing can accelerate the damage. Yes, hard toothbrushes can scrape away the softened edges. But brushing is almost never the primary reason they appear. The true cause is deeper. It is mechanical, biomechanical, and for seniors, it is exceptionally common. 2. Why seniors experience abfraction more frequently. After the age of 50, several subtle changes occur in the mouth. The enamel becomes slightly more brittle, the gums recede, exposing a more vulnerable part of the tooth. Bite patterns shift, sometimes due to missing teeth, old fillings, dentures, or grinding. Jaw muscles tighten during sleep more frequently. Stress patterns change with age, illness, and posture. These changes create a perfect storm. A storm your teeth feel every day, during chewing, swallowing, and even clenching without knowing. Most seniors underestimate these forces, but a human jaw can generate up to 250 kilograms of pressure while grinding at night. That is stronger than anything your toothbrush could ever do, and this chronic, silent force is what slowly flexes the tooth. Not enough to break it at once, but enough to create microfractures at the base, until tiny fragments begin to flake away. 3. The real culprit: excessive force on the tooth. Let's look at the two main causes. 1. Bruxism, unconscious clenching and grinding. Many people grind their teeth at night. Many never realize it. You may have signs without even knowing: morning jaw stiffness, headaches at the temples, flattened tips of the teeth, cracks on the enamel, tightness in the neck or shoulders. Nighttime grinding can exert forces far beyond normal chewing. Imagine bending a metal paperclip again and again. Not enough to snap immediately, but enough to weaken the same spot, always the same spot, until it finally breaks. Your tooth experiences that same stress thousands of times every night. 2. Malocclusion, an uneven bite. If your teeth do not meet evenly, one tooth, or a small group, may absorb most of the pressure. Every time you swallow, every time you chew, every time you gently clench while concentrating. Just like pressing repeatedly on the same point of a twig, the tooth begins to flex at the gum line, slowly carving its own notch. 4. The progression of damage. If you do nothing, Dental abfraction does not progress overnight. It progresses quietly, gently, silently. Let's walk through each stage. Stage 1, sensitivity begins. The enamel has no nerves, but the layer underneath, dentin, does. When abfraction exposes dentin, you may feel a quick, cold sensation while drinking, a sharp jolt with sweet foods, a fleeting zing with acidic drinks. These sensations are not random. They are signals. Small, soft whispers from your tooth saying, "Something is happening here. Pay attention." Stage 2, a plaque trap. Forms. That little wedge is hard to clean. Bacteria settle in the small corner. Plaque sticks more easily. Gums around the notch become irritated. Inflammation may begin, sometimes even decay inside the notch itself. Now you have two problems: biomechanical damage and bacterial involvement. Stage 3, structural weakness develops. The tooth continues to flex. The notch deepens. The walls become thin. This is not just a surface change. It affects the tooth's foundation. It's like shaving away wood from the base of a tree. The tree still stands, but becomes more fragile with each passing season. Stage 4, catastrophic failure. This is the part most people never hear about. One day, you are eating something soft, a piece of bread, a banana, a piece of cheese, and you feel a crack. The tooth fractures at the gum line, not because of what you ate, but because the foundation had been weakening for years. Repair at this stage becomes complicated, sometimes even impossible without extraction. And that is why understanding abfraction early is so important. 5. Additional factors that accelerate damage. While force is the primary cause, several secondary factors make abfraction worse. 1. Acidic diet acid softens enamel. Soft enamel breaks more easily under stress. Common acidic triggers: citrus fruits, sparkling water, sodas, vinegar-based foods, certain medications that dry the mouth too. Aggressive brushing. This does not cause the notch, but it can enlarge it quickly by scraping away already weakened enamel. 3. Gum recession. When gums recede, the exposed portion of tooth has naturally less enamel. It is more vulnerable to flexing. 4. Old dental work. Old fillings or crowns can shift how the teeth come together, creating stress points. Part 6. How to know if you are at risk. Here are gentle self-check signs. You feel notches with your tongue. Teeth feel more sensitive than they used to. Your gums look lower than before. Cold water causes sudden discomfort. Your jaw feels tired in the morning. You hear clicking when opening your mouth. You notice tiny vertical cracks in the teeth. You have worn or flattened biting edges. These are all subtle clues your mouth gives you, clues that something is off in your bite or jaw mechanics. 7. What to do? Practical, senior-friendly solutions. This is where the good news begins. Abfraction can be managed, protected, slowed, and often completely stabilized. Step 1. Address the cause. Bite forces. A dentist may perform one or more of the following. Occlusal adjustment. Tiny refinements on the enamel to balance the way your teeth meet. A custom night guard. This is one of the most effective tools for seniors. It cushions the teeth, absorbs pressure, and protects the gum line. Orthodontic correction. For major bite imbalances, aligners may be recommended, even for seniors. Step 2. Repair the notch if needed. Once forces are controlled, the tooth can be repaired. Dental bonding. A tooth-colored resin fills the wedge and protects the dentin beneath. Desensitizing treatments. Often applied in the office to calm the nerve. Crown placement. For advanced weakening, a crown may encase the tooth like armor. Step 3. Gentle home care. Here is what seniors can do daily. Use a soft toothbrush. Use slow sweeping motions, not scrubbing. Use low abrasion toothpaste. Rinse after acidic foods. Stay hydrated for saliva protection. Avoid grinding habits during daytime. Step 4. Supporting your jaw muscles. Simple exercises can help. Exercise A. Jaw relaxation. Place your tongue gently against the roof of your mouth. Allow your jaw to drop slightly. Hold for 10 seconds. Repeat 5 times. Exercise B. The warm towel technique. Place a warm towel on your cheeks before bed. It relaxes the muscles and reduces nighttime clenching. Exercise C. Gentle neck. Stretches. Neck tension feeds jaw tension. Slow stretches reduce both. These simple actions support the entire chain of muscles connected to your bite. 8. A few soothing reassurances. If you have dental abfractions, you have not failed at oral hygiene. You have not brushed too hard. You have not done anything wrong. These notches occur because your teeth are strong, and they have worked hard for you for many decades. Your smile has served you through meals, laughter, conversations, life transitions, stressful nights, joyful mornings. Abfraction is not a sign of neglect. It is a sign of experience, and experience can be cared for, protected, and strengthened. So let's gather everything we've learned. A small notch at the gum line is not just a cosmetic detail. It is a message. A soft whisper from your tooth saying, "Pay attention here, something needs care." Ignoring abfraction can lead to sensitivity, gum inflammation, structural weakening, and in severe cases, tooth fracture. But with gentle awareness and proper support, you can protect your teeth beautifully. A balanced bite, a soft toothbrush, simple exercises, professional evaluation, and early care. These actions can make all the difference. Remember this: your smile is not something to fear losing. It is something to care for, tend to, support, and strengthen, especially now, especially in this stage of life. And you are not alone in that journey. I am here to guide you.